Welcome back to Deep Blue Perspective. This is our August edition, and this is where we try to make healthcare a little bit easier to understand, a little bit easier to use, and hopefully a little bit more relevant to everyday life. I'm Steve Church with Blue Mind Health. Julie, introduce yourself.
I'm Julie Miller, VP of Sales here at Blue Mind, and we are excited to bring a guest with us today.
Yes, we have Brittany Lisby. Did I say that correct?
You did.
Our nurse practitioner here in Bardstown, and we are going to be talking about something that's pretty hard to avoid this time of year, right, Julie?
That's right. So we're talking about skincare. One of the things that we want to make sure we're discussing is things that we need to do to keep healthy skin while all of us are outdoors. And I know that it would make no sense to tell Mr. Church that he needed to stay indoors with all the activities he has.
I really like the sun.
Well, thanks for having me. I'm excited to be here.
Absolutely. Yeah, golf, lake, vacation time. I'm not planning on giving any of those up. So this is very important to me.
That's right. So we're not going to ask you to give it up. We're going to think about ways to do that in a healthy fashion, and Brittany's going to help us with that today.
Yeah, one of the things that is so unique about Blue Mind is we have practitioners that have a breadth of experience in many, many different areas. And that's also why employers who register and sign on with a membership at Blue Mind, and also individuals and people who do that through a payroll deduct product, you get access to the wealth of knowledge of nice people like Brittany who actually care, and give a hoot about people, as we would say down south. So anyway, we're not going to make this scary, right, Julie?
That's right. This is not going to be scary. We're really wanting to focus on prevention and what we do in our regular routine and things like that to make sure that we're thinking about awareness and what to watch for and just overall skin health.
So the first question that I usually come across when people are asking about this is this something I should get checked? I'm married to a pharmacist, so that is another profession that gets questions a lot. It's amazing what you will find people doing in a retail pharmacy setting, because they think it's primary care sometimes.
Yes.
But Brittany, question that I would have to ask you is, if you see a mole or spot or something like that, when should we be concerned? When should we not be concerned? Just generally.
Yeah, generally, I tell people not to freak out if they have a mole or freckle. Most of us have those.
Right.
But there's some things they should look for. Has it came out of nowhere? Is it painful? Is it a freckle or a mole you've had forever that now just looks really different? That's when it's worth coming in and talking to us, and we start a conversation of, is this something we should worry about or nothing to worry about at all?
Right.
And that's one of the things that we want to emphasize to our Blue Mind members is that you don't have to decide on your own. There's no cost to come in and see us, right? So you're not worried about a copay or deductible.
Right.
Make an appointment, come in, let our experts take a look and see if it is something that's concerning or if something that doesn't need to cause you stress.
Yeah, no, I think that's a great first step. With us being primary care, you don't have to try to get into dermatology, which can take a little while.
Right.
Let us be your first step. Avoid that copay. Come in and let's just talk through it, see what the concerns are, and you might not even need to see dermatology.
Absolutely.
And that's such a great point. And there's two things that came to mind during that point, right? Number one, we can be the first line of defense, maybe to avoid the dermatology. But let's just say that we needed to go to that next step. At Blue Mind, we have a concierge specialist referral, and we can assist with that. On your own, you might not get to a dermatologist for the next 6 months.
Absolutely. It's a very hard one to get into.
That's right.
So, we will work and get you in where you need to go.
But not every questionable mole requires a biopsy. Right?
That's right. So yeah, no one needs to freak out. If we feel like your mole is something that should go to the dermatologist, they can determine if it's something you need a biopsy of.
Yeah, and I think that WebMD and some of the internet access has really made your all's job harder.
Yeah.
Because we self-diagnose.
Yeah, absolutely.
A lot, right?
Yeah.
So anyway, that's a sidebar.
One of the things that I would love to explore with you is your area of expertise. So when we think about family practice medicine and things like that, you mentioned that we can refer to dermatology when it's necessary, but maybe talk to some of the things that we can do from a family practice arena and how that goes into not just looking at the skin, but the whole body experience.
Now you bring up a really good point. You know, someone might come in, something that comes to mind that I see very often is skin tags. And not that a skin tag means there's something going on, but I might have someone tell me, hey, you know, I've had a few skin tags come up recently. And as a provider, that gets my brain thinking, well, yeah, cosmetic, let's look at this. But also, have we checked your A1C lately? Is there something metabolic going on? Is there trouble with your blood sugar? So it just kind of makes me think, where are we? What do we need to check? The skin can tell us a lot. Yeah.
Look at you putting your Sherlock Holmes hat on, digging into that. But I love it too that you mentioned A1C because we can test right here in-house and get the results while they're here with you.
Yeah. No, it is such a blessing. Working in concierge with Blue Mind, we really get to love our patients up. So we can draw that, and I can come in and go over it with them right in person and discuss any concerns they have, anything that's popped up in my brain that I want to tell them right in person. A lot of places you're sending that out and you're having to get a phone call from someone you might not have even met when you were in office. So it is a blessing.
That's awesome.
Yeah.
A personal touch does mean a lot. It really does. So you mentioned the A1C. What are some other examples of things that you can kind of go down that Sherlock Holmes route from your knowledge of the patient a little bit better than maybe somebody who doesn't have enough time to spend with the patient?
Gosh, I mean, there's so many things our skin can be telling us. Anything from dehydration to allergies. You know, goodness, if someone's having trouble with an infection healing, even if we treat it and we have them come back and it's just not healing properly, goes back again to, hey, is there underlying issues internally, something we're missing? You don't want to miss the root of the issue. Sometimes skin is a secondary issue. But what's the primary issue? What do we need to fix to, you know, solve the whole problem?
And you having the extra time to sit and ask more curious questions,
Yes.
that I'm assuming that leads you to better results, right?
Oh, absolutely.
Right.
Yes. It's like I always say blessing with Blue Mind
Right.
because I've worked in the real world where you get 10-15 minutes with your patient and you really, like Michael says, we like to love up our patients.
Right.
You don't get that time to love them up. Here at Blue Mind, you get to sit down, we get to talk. What are questions you have? What are questions I have? And we really can come up with a good plan and try to get the best results.
I also love the real world, right? Because when you walk into a Blue Mind clinic, it is like you're walking into a different world of healthcare. It is concierge medicine, but it is so much more than that, and it's not really available universally like we provide it to employers. I mean, there are ways to get to it, but I think we have such a unique system here.
We do.
You know, this clinic too, right in this moment, I think is a good model too, because we have added on a new client. We've got quite a few more folks that are going to have access. And as part of that, Brittany, you're now part of our full-time team because we are making sure that we give you that bandwidth to spend time with your patients and make sure that the existing clients don't have trouble getting in, as well as new ones coming on board, because it is important to us to make sure we give you the room to do what you need to do.
Yeah, it is a beautiful thing. Yeah, we want to be able to sit down and give our patients, we want them to feel like a patient, not a number.
That's right.
So yeah, it is a wonderful setup. We have a great thing going here.
There we
Well,
go.
We do.
some of the pushback that we get, Brittany, when we're out talking to employers is that it sounds too good to be true,
Yeah,
right?
and it really does, don't it?
It does. It does. So at some point in my life, I have heard about the ABCDEs of skincare. Is that something that you use? Is that something that can you walk through those a
I
little bit?
do. I'll tell you, in the 8 years I've been a provider, I've done a few different free clinics, and that is kind of my go-to. If I'm going through a lot of people educating or doing skin screenings, and I use it in practice too, I'm like, hey, this is something simple. You can, if you forget what we talked about today and a mole comes up that you're concerned about, pull it up on your phone.
Right.
The ABCDE
Right.
kind of numbers and or letters, it'll walk you through what am I looking for.
Sure.
And should I be worried? Should I go see someone? Should I see Brittany at clinic or one of our other wonderful providers? So yeah, it's very simple. It just walks you through, are these things happening with my skin concerns? So it's asymmetry.
Yep.
Is there, if you look at it, is there one side that's like kind of lopsided and one's round, or is it just a perfect circle? So asymmetry. Border, does the border look rigid or blurred? You know, if there's anything where you're like, the borders just look odd, that's an indication maybe I should go in and we should have it looked at.
Right.
Color is for C. So if you're like, wow, it's one solid color, usually not a concern.
Mhm.
But if you're like, it's always been this light brown and now it's got kind of a dark black dot coming up, or just some different changes in color, that can be something worth coming in and us looking at it for sure. D is diameter. So that is, you know, is it pretty large, or did it go from small and all of a sudden the diameter's just really changed?
Right.
My big point is there a lot of changes, or is this something out of the blue that just kind of made you think, what is this? If it's enough for you to kind of think, what is this? It's probably worth coming in here and just having that reassurance. That's a lot of what we do in healthcare, is giving that reassurance and letting people know they don't have to worry so much about things.
We've got enough to worry about in our lives, right?
We do, yes.
You know, and things are
Yes.
changing pretty quickly.
Mhm.
You know,
Yeah.
and the model that we have here allows us to be a little bit more fluid, I think.
Yeah.
Right. So that's pretty cool.
Yeah.
It's really good.
And I love that, you know, people worry a lot. Like you said, we got enough to worry about. So with Blue Mind, if we talk about something this week and next week you're still wanting to check in with me, or even Friday, come back.
Right.
You know, that's what we're here for, and that's the beauty of, we don't have co-pays. You can come back and let me love you up as much as we need. So
Sure.
no need to worry.
You know, one thing that I absolutely love about everything we just stated there is that we keep it simple. And so in a very complicated world and trying to navigate different health concerns and things like that, you don't have to worry about billing. You don't have to worry about whether or not it's going to be covered. You come in, you see us, we take care of you, and it's done. And so I think that's a big piece too, is that we can just keep it simple for you so that you get the appropriate care that you need.
You know, I always kind of talk about my own experience at Blue Mind, because I was with Lisa in our East End clinic last
Yeah.
week, right?
Yeah.
And I shared with
Steve's become a frequent flyer.
well, you know,
I
a frequent flyer, but I mean, there's no barrier to entry, so why would I not come,
And
right?
we love Lisa
She's
and Elsie.
really,
It's
really
a great
good.
team out there. Yeah.
But so I walk in and I have a little bit of a white coat thing, right? You know, and so my blood pressure was a little bit elevated, and you know, so Lisa knows that about me, and so she said, you know what, we're just gonna take this at the end after we talk, right? And it significantly calmed down. Back to your reassurance, right?
Yeah.
My experience with healthcare up until this point has not been that I would be reassured all the time. It was information, one question, I gotta get to the next patient,
Yeah.
right? There was no reassurance in that. So I know we're talking about
Exactly
skincare, but the overall experience coming in from head to toe is gonna be good,
Yeah.
right?
We want you to leave without worries. We don't want you to leave with more worries. We want you to be like, oh, I have this weight lifted off my chest because we got to talk about all my worries and I got the reassurance and we have a plan.
Mhm.
So yeah, it means a lot.
So if I had something come up during one of my golf outings, or you know, boating trips, or skiing,
Yeah, he has a lot of fun
I know,
outside.
I
Right? I love it.
I'm a little offended about the golf thing. I mean, I'm
We're
always
all gonna
outside.
live vicariously through Steve
Oh,
now
yes.
this summer.
I have been blessed. I have been blessed. But if I took a picture of it on my phone, right,
Yeah.
and said, "Hey, Brittany, can you take a look at this? Is this something I need to come see you?" Is that something that we could do at Blue Mind?
Yeah, I mean, as long as it's clear, you
Right.
know, you
Yeah,
might
yeah.
have to have your buddy take it for you.
Yeah,
It might be-
right.
But
right.
yeah, you know, as long as it's clear, and then, you know, we do telehealth.
Mm-hmm.
And if anyone ever has a phone call they want to make, we can talk through these things we just talked about. Like, hey, well, did it come up all of a sudden? Is
Right.
it painful? Like, from what I can see in the picture. And we can kind of get that reassurance, like, yeah, let's just watch it. Or, hey, just come on in and let's take a look in person.
And again, the barrier
Yeah.
not being there with a copay or a financial thing, we can pretty much get people in same day or next day at the worst,
Yeah,
right?
there's no barriers.
Right.
And it's such a good thing.
That's really cool. That's
Yeah.
really cool.
So we've talked a whole lot about skincare and things like that. That was one of our big focuses today. And even though we've got kiddos going back to school, we've still got a good 6 weeks or so of warm weather,
Oh,
maybe
yeah,
more.
yeah.
So
Yeah.
we're not at the end of summer yet.
No.
So as we're doing that, while we want to be mindful of healthy skin and things like that, what are some of the other things that you're seeing this summer, or things that we can be mindful of to come on in and see Blue Mind?
Oh yeah, summer's a big one. Lots of poison ivy,
Oh,
type
yeah.
things. Tick bites. I'm big on telling my patients, if you got kiddos or you're outside playing, try to make that part of your hygiene every night. Do a tick check.
Right?
The sooner we get those off, the less problems we're gonna have.
Yep.
So that's a big one, and we're always here for those questions and those exams. Like, hey, take a look at where this tick bit me. That's what we're here for. What else? Bug bites in general. What else? Sunburns, of course.
Right.
Those will sneak up on you.
I just came off of a two-day golf tournament. That's why I'm so.
Yeah.
I reapplied.
You got that
Summer
sun
glow.
glow. You got the sun
Uh,
glow going. Yeah. So we're here for all those skin challenges, and I'm sure y'all can think of some other ones, but those are all pretty common summer issues, and we're here for all of them.
Well, tick bites are serious. I mean, a friend of mine, he got whatever that Rocky Mountain or whatever,
Yeah.
and he was
Minus 5 fever.
misdiagnosed for a long time, and he suffered pretty bad. I mean, that's serious.
It can be very serious. Yeah, it can. People might not realize they were bit by a tick or something of that nature,
Right.
and they tell us that, and then we'll end up ordering labs and find out down the road that's what it's been.
And I think it's important maybe to bring up if you do find a tick during your check, right? You need to know about it if you're one of our clients. All they have to do is let us know. Then that way, the next time that they come in, we can consider
Yes.
that, right?
Yeah.
Because people forget. I've been feeling bad for like 6 weeks. I don't know what it is. It comes to find out. 8 weeks ago they were bit by a tick,
Yeah.
and they've forgotten it, right? So when we're talking about skincare, I think it's important to bring that up too.
Yeah, it's a big thing. I preach a lot about, hey, just check every night before you go to bed, check your kiddos, and we try to avoid all these problems because alpha-gal's really big right now, where they're allergic to mammal type foods and products.
Okay.
That's a big allergy.
Really?
I'm seeing, I was just telling someone this morning, I've seen more this year than I've ever seen. I don't know what's going on, but yeah, so do those tick checks for sure.
Well, I think it's important to note too that while the pollen levels might be down now as opposed to spring and fall when it's worse, we also take care of asthma and things like that too. So whether it's for kiddos or adults, things like that, we can see patients and make sure we're helping them manage that as well.
Absolutely.
And telehealth is again really. I just want to reiterate that we can do some triage
Absolutely.
without somebody leaving their house, and if necessary, then they can get in the car and come over here.
Yeah, I think it's a great thing for you to point that out. It's a great first step for some people. If they're not able to get in, we don't want them to put off seeing us
Right.
because they can't get here physically. It's a great first step for a lot of things. Yeah.
Well, and Julie and I have been making presentations a lot for employers, and one of the slides says that healthcare is generally not expensive, but late healthcare is always expensive.
Yeah, that
Right.
says a lot.
I mean, really, early
Yes.
intervention is the key to better health quicker, but certainly less money spent on the system.
Absolutely.
Right.
Yeah,
So
yeah. Prevention is everything.
that's right.
Staying on top of it, preventing it.
And it's hard. It's and people worry about their oil change, but they don't worry about coming in and seeing their doctor.
Yeah. Yeah.
It's kind of messed up.
It is kind of messed up.
We're changing that one person at a
Yes,
time.
one person at a time.
This is my favorite part of the script: myth versus fact. What do you think, Julie?
I think she's up
I
for
think
it.
are we gonna put her on the spot?
Yeah.
Sure.
We're gonna alternate, right?
Yeah.
So we're gonna just throw these out
Yeah,
here, myth
so
versus
awesome.
facts, and I'm
Fun
gonna
questions.
go first. Myth versus facts. You only need sunscreen at the beach, lake, or pool.
The kids wish that was true. That's a myth. My kids wish that was true. Yeah, if you're out in the sun, get that sunscreen on. And as you've mentioned, he likes to have a lot of fun in the sun, which I love. But yeah, it's for all the things. The golf, the pool, outside working in the yard, going for a walk. Yeah.
Yep.
All the things.
I do use sunscreen, but I don't reapply it as often as I should.
That's it. We're gonna have to get him the sports drink so it sticks on him.
Right, you gotta need it. If left unsupervised, that's my problem.
Oh, right.
Uh-oh.
There we go.
When Jennifer's with me, I'm better.
There you go.
There we go.
Okay, next one. A lot of folks think that if they have a darker skin tone or if they've already gotten that good base tan that they don't have to worry about sunscreen or sunblock or getting sunburned. True or false?
Oh yeah, it's false. I wish, but every skin tone needs that sunscreen. Yeah.
Okay.
Yeah. Even if you've got that good base tan, that means you're taking those UV rays, so you definitely need to be applying sunscreen. Everyone needs to apply the sunscreen.
All right.
Yep.
Good to know.
Yes.
Okay, so good example. Monday it was kind of partly cloudy. I was out at that tournament. If it's not sunny, if it's a cloudy day, do I still need sunscreen?
Yeah, you do. Yeah, even on those cloudy days, you gotta take it with you. Yeah, you can still get the UV rays through the clouds, so you're still at risk, even though it seems like you're probably not. You are.
Right.
Yeah.
Because a lot of people think if you're not hot, if the sun's not beating down on you, that you're fine, right? But that's totally not the case.
Not the case. And I always tell us women have a little trick we can do, because if you put on makeup, a lot of our makeups you can buy have sunscreen in them. So we kind of have it easy. Sometimes we're putting it on already.
So I should start wearing makeup.
So start wearing makeup.
That will be a whole nother podcast.
Yeah, we should probably avoid that one if we can.
Just saying.
So talking about that, one other thing is sunscreen enough? Is that all I need to think about? We've talked about reapplying and things like that, but do we need to think about anything else besides just putting on sunscreen and then we've checked the box and taken care of everything?
That's a good thing to talk about. I think the more the merrier, especially, like you said, it is hard to remember to keep applying. We are busy people.
Right.
So say you put on that hat or you have kind of more of a shade set up if you're outside at the pool, then you kind of have extra protection if you forget to reapply that sunscreen. So the more the merrier, hats, sleeves, shade, nice beach umbrella, or full umbrella.
My grandkids have those shirts that are like the rash guard shirts with its long sleeves.
Yeah.
So especially when they're younger,
Right.
it is
Yes.
so tough to get them
It
to
is
stand
so
still and
hard.
wrestle them into that stuff.
And
Well,
it
it
is.
is. It is. And those things, they weren't around when we
Right.
were growing up, so they were really good. When I'm out west, I usually use the sun shirt. So
Yeah.
They're
It makes
very
a difference.
helpful.
okay, let's give you one that's true. A serious sunburn when you're young can affect your skin cancer risk later. That's true?
It's very much true. So yeah, like we were talking about earlier, prevention. Starting early in life, making the best decisions we can is going to help us have better outcomes in the long run.
And we can create habits for our kiddos.
Yeah.
Because again, kind of telling my age a little bit. I mean, when I was a teenager, it was baby oil and putting lemon,
Yeah.
juice in my hair or whatever.
Yes,
But
we
we
did
didn't
all
know.
the wrong things.
Yeah.
Copper tone. It was you were all oiled up and ready with bronzer and everything else.
Yeah.
Right,
And
so-
I do feel like modern healthcare is really the kiddos, the younger generation. I feel like they really are stepping in and learning preventative stuff, which I love. These little kiddos will have a skin routine and all this stuff. So it really does affect your years down the road, the long run,
Right,
for
the long
risk
run.
and stuff like that.
That's right.
Yeah.
Well, we're not telling people not to spend time outdoors. We're just telling people to be
Mindful.
judicious and prudent, right?
Yeah.
Those are two words that I just remembered. But yeah. And if you have a question and you're a Blue Line member, just come see us.
Yeah, I'm with you. Please go outside. Please enjoy the great outdoors. It's so good for your mental health, but put on that sunscreen.
Do it wisely.
Oh, but
Yeah.
and we've had a podcast on mental health, but I'm glad you brought that up just to reinforce one more time.
Yeah.
Part of the Blue Mind membership is that we are going to take care of the whole body and the soul and the mind. So the mental health aspect particularly right now, is a hot topic, and we can talk through some issues here. We can get you the appropriate level of care if you need to go further than our walls, but it's big.
It's really big, and I don't know if everyone realizes in primary care, that's a lot of what we do. We want to make sure your mental health, your spiritual health, like you said, is good, and that it's a full circle. It affects your physical health. Everything is connected.
So if we are going to be outside for our mental health, we need to do that with sunscreen.
Exactly, and you're protecting everything.
And, so let's make it ridiculously simple. Julie and I are members, and for the next 2 minutes, Brittany gets to be the provider. Give us 5 things you want to do this summer, that you want us to do this summer.
Okay, well, let's see what I can come up with. I already told you guys, tick checks are very
tick
important.
checks.
Going outside, applying that sunscreen. Go ahead and add that extra protection. Put on your hats, wear your sleeves, stuff like that. What I really want people to do is if they have any concerns, just come in and see us. Don't put it off, don't worry, don't give yourself a stomach ulcer. Come in and see us, that's what we're here for. What else am I missing? I feel like I'm missing something here.
Well, I will say this, we are going to have text messaging coming out very soon to all of our members. So we love it when everybody watches our podcast, but we also know that we need to send out those sweet little reminders so that people think about coming in to see Brittany and our team for those checkups and everything else. So we're going to have that coming out soon. And just being mindful of access to Blue Mind and everything that we can do. So,
well, Julie, you and I have talked about this before. Communication is the key, particularly for our client base, for our brokers, for the people who are prospective members of Blue Mind. It is hard to over communicate about health, and when we're changing the trajectory of people's lives because they're getting healthier, their chronic conditions are getting better, their overall health, their mental health, their well-being is being taken care of. They can get out and enjoy these things that we've been talking about today. Granted, I mean, it is fun to make fun of myself on these things, but one of the great things about being healthier into your older years is that I don't have to worry about going out and visiting my daughter in Utah or taking a trip and being healthy enough to do those things. An ounce of prevention is worth a pound of cure, right? As we've been talking about.
Absolutely.
And Blue Mind is a great place for that. So
awesome.
Bring us home, Julie.
Well, we're just excited. Brittany, thank you so much for joining us today. We are excited to have you with us, not only today in our podcast, but full time with us now and everything else as we grow here at Blue Mind. So thanks everyone for joining us yet again for one of our Deep Blue Perspective conversations here. We hope that everyone will enjoy the rest of the summer. Come see Blue Mind. We'd love to see you and take care of you.
And if you're an employer that's hearing this and you're not a member, let us know and we will come out and give you a feasibility study that will show you the pros and cons of working with your population. If you're a broker partner that has not had a chance to see how we work, we'd love to invite you to a clinic tour to see wonderful providers and just a general feel of walking into a Blue Mind clinic. And if you have some opportunities for us that you want us to look at, we would love to take care of that for you.
Most definitely.
Our job is to make your job easier. Healthcare is tough right now. Blue Mind is taking a lot of the problems out of the equation because we always know that we are going to have health concerns. But coming to a trusted partner like Blue Mind and Brittany that makes it a lot better. So thanks, Brittany, for being here. It's been a really good visit, and we will see you next month
Yep.
on Deep Blue Perspective.